Hello, and we would like to welcome all of you to our webinar today, Building Power Together Inside NDAC Advocacy and NDSC Resources. We are so excited to be here with you today, and we are going to be talking about our National Down Syndrome Advocacy Coalition, a little bit about policy, and then we're also going to have you hear from Magaly Diaz, who is our Multicultural Coordinator, and she's going to share about some of our Spanish resources. And Chris Newlon is going to share about some of our other resources at NDSC. Of course, you're also going to hear from Jessie Smart, one of our self-advocates and a member of our policy council, and you're going to love that. Next slide, please. This is a quote from Jillian Benfield, who many of you know. She's a rockin' mom, an NDAC member, and a former Down Syndrome Diagnosis Network board member. Jillian says, advocacy for my child has lit a fire in me I didn't know existed. It may bring out my most intense parts, and I won't apologize for that. I won't let anyone put it out. I'll keep roaring for him, her son, and for others like him, because this doesn't bring out the worst in me. It brings out the very best. NDAC equips me to be a stronger, more effective advocate for my child. Because of this community, I'm not just hoping for the best for my child, I'm actively securing it. As many of you know, Jillian is an author, and she's one of our most engaged NDAC members. And this was the quote she gave me when I asked her to share why she felt it was important for all of us to be involved in advocacy. Next slide, please. Today, you're going to hear from me, Jawanda Mast. I'm the NDSC Grassroots Advocacy Manager. Jessie Smart, one of our wonderful self-advocates, who is on our NDSC Policy Council, but she's also on our NDSC Self-Advocate Council. Magaly Diaz, who is our Multicultural Coordinator and a rockin' mom. She'll speak more about that. And Chris Newlon, our NDSC Resource Support Specialist, also a rockin' mom, who's going to talk a little bit about that and our other resources that we have at NDSC. Next slide, please. Each of us made a quote of why we thought it was important for individuals, for family members, rockin' moms, really anyone to be involved in the National Down Syndrome Advocacy Coalition. And for me, as a mom and a professional, I became involved in policy because of my daughter, but I also had an interest in policy. But I believe it's really important for us to be involved in policy and share our voice, because I've seen what happens through the power of one voice and one personal story. My daughter and I have done lots of advocacy together, and we've been involved in passing bills from the Federal ABLE Act to getting a state assessment changed because of her testimony. On a very personal level, it's been incredibly fulfilling to me to see how my daughter Rachel has picked up the language of advocacy and grown into a fierce advocate in her own right. You know, when we show up, when we learn, when we engage, when we use our stories, we can make a difference. We hope that today we can help you to see how you might utilize NDAC to make a difference. Next slide, please. This is just a little bit about the National Down Syndrome Congress. It tells you our mission, our purpose, and our vision. We are very focused on individuals with Down syndrome and try to empower them in any way we can. We've existed for a long time, and we serve families, affiliates, and we also, of course, serve individuals with Down syndrome and ensure that their rights are recognized and protected. Next slide, please. In the Policy and Advocacy Department at the National Down Syndrome Congress, our work is somewhat three-pronged. We have grassroots advocacy, policy work, and policy and advocacy resources. Today, we're going to primarily focus on grassroots advocacy. Grassroots advocacy is our National Down Syndrome Advocacy Coalition, the training opportunities we have, our upcoming NDSC Policy Summit, advocacy training boot camp at the NDSC convention. Of course, all of this flows out of the policy work that we do, and we use the policy and advocacy resources we have to help empower advocates, affiliates, individuals across the country. Next slide, please. If you've never heard of NDAC, I want to share a little bit about it, and you'll see a QR code here where you can go and learn more, or you can join through an easy online application that we have. The National Down Syndrome Advocacy Coalition is NDSC's Grassroots Advocacy Program. Grassroots advocacy begins with individuals, and we are here to help you learn the tools that you need to advocate for change. Through federal policy primarily, though we do give support on the state and local levels as well. Much of what you'll learn from NDAC, you'll also be able to use at any level of advocacy. We have training opportunities through quarterly update calls or webinars on the legislative agenda, where we give out information on the most up-to-date information on policies on the federal level, and sometimes on what's going on in different states. We do webinars, workshops, and policy deep dives to help people get a better grasp of advocacy and policy. We do a meetup at the annual NDSC convention. We also have access to a private NDAC Facebook group where individuals who are members of NDAC are able to share information and learn from one another. Perhaps you're working on a bill in your state, or you've had a bill passed in your state, or you have a bill that's being debated in your state. If you post in the NDAC Facebook group, you may find that there are others that can give you information and direction for your own state. Let's not recreate the wheel. Let's learn from each other. It also provides discussions with other advocates, and we give important up-to-date policy updates. We also have a portal that's new. It's called the NDAC portal, and every individual in NDAC has access to a personal portal where we share a lot of information, some that's shared in the Facebook group, some that we want to share with our NDAC members, but might not be something that we would share on the NDSC main social media pages. We try to provide you with timely information on the latest policy topics so you can stay up to date on what's happening. Anyone can be a member of NDAC. We accept applications from individuals of all abilities, level of advocacy experience, as well as Down syndrome affiliate groups and other cross-disability organizations and statewide coalitions who may be interested in advocacy. Self-advocates are a really important part of NDAC, and we try to empower them as much as we can and write many of our materials in plain language for their use. Next slide, please. One of the things I want to mention about NDAC as we go to this slide, often we are contacted by an elected official's office or by a committee or by the head of a department on the federal level who may ask us for input from stakeholders. Input from stakeholders is individuals like you, individuals who have family members with disabilities who may be educated in the public school system, or maybe there's comments that are needed on something that has to do with employment. They may reach out to us and ask us for help, and the way we get input from stakeholders is through our NDAC group. So from time to time, you would see an email from us that said, hey, do you have any comments on this, or fill out this survey or whatever. We're also sometimes contacted by an elected official's office because there's a bill that's in committee and it needs passed out of committee, and they need us to help rally the troops. That's where NDAC would come in. We would find out who was on that committee, and then we would reach out to NDAC members in that district or state and they would reach out to their elected official and ask them to vote pro or against something that we were working on. It's a great way to feel empowered, and we've been thanked by many elected officials' offices for helping to get our grassroots advocacy network going so they could get a bill passed. We have almost 1,200 members of NDAC. We have members in every state across the United States, and we have 134 self-advocate members. We have 43 states in the District of Columbia who have members of NDAC. We are missing self-advocates in 7 states, and self-advocates are simply people who have Down syndrome who want to advocate. And so if you know anyone in any of these states, we would love for you to let us know so we could ask them to be a member of NDAC. We think the most important advocates are self-advocates, and we think what they have to say is pretty important. We have group members across the country, 38 states and multiple countries, and we have 587 Facebook members in our private Facebook group. Next slide, please. I'm just going to touch briefly on our NDSC policy priorities. We have 4 main policy priorities: education, which is keeping Individuals with Disabilities Education Act and Department of Education intact. We all know that there are issues with a lot of things, and the Department of Education and IDEA aren't perfect. However, instead of tearing them down, we believe that we need to work to fully fund IDEA and to equip people to be able to do their jobs and equip people to be able to serve individuals with disabilities. So we work to that end. Employment goal. We promote competitive integrated employment where individuals with Down syndrome and other disabilities are employed for a fair wage in a competitive community setting in as much as possible. Medicaid. Medicaid is a hot topic right now. One of our primary goals is to protect against caps, cuts, block grants, and we want to expand and improve home and community-based waiver services. Many of you may not know what home and community-based waiver services are. Most people only think of Medicaid as insurance for the poor or disabled, but Medicaid is far more than that. Through Medicaid, there are waivers called home and community-based waivers, and those waivers empower people like my daughter, Rachel, who I think I failed to mention when I introduced myself. My daughter, Rachel, is 26 years old. My daughter, Rachel, lives and works in the community. Well, she lives with us, but she works in the community at a hospital. She just celebrated her 4th anniversary. The HCBS waiver helps to support Rachel and others like Rachel so that they can live and work independently in the community. As your children get older, this will become a very important program to you. This is one of the things that we advocate for and educate on. Social Security, as you all know, is also very important to individuals with disabilities and their families. We're committed to preserving SSI and SSDI and removing barriers to independence and promoting financial security. Next slide, please. Other priorities we have, and we work on all of these, but we partner more on these priorities with others who may have more expertise than we do. Healthcare, preserving affordable and accessible healthcare for individuals with Down syndrome and other disabilities. Financial security, promoting economic opportunities and independence. The ABLE Act and ABLE improvements are a big part of this. I certainly hope all of you know about the ABLE Act. My daughter and I were very involved in passing the federal ABLE legislation, and my daughter opened the first Kansas ABLE account. I live in the state of Kansas, and she's very proud of that and loves to tell people how she is able to put money in her ABLE account. Before ABLE accounts, individuals with disabilities can only have $2,000 in assets without losing their means-tested benefits. And while you still have an asset limit, you can now save money in an ABLE account and it not count against your assets. If you want to know more about that, send me an email. Civil rights. We work to ensure equal rights and protections under civil rights law. Example, right now we're working on a voting toolkit to help individuals with Down syndrome and their family members know their rights, know how they can vote, and learn what to do if they feel like they have been discriminated against at the polls. Housing and transportation. Increasing safe, affordable, accessible housing and transportation is very important to us. Housing is a crisis in our country, and certainly affordable housing for individuals with disabilities is a key problem. Transportation is also one of the most commonly cited problems for individuals with disabilities in the workplace. We do not have good public transportation as a rule in our country, and this makes it very hard sometimes for individuals with disabilities to get to and from work. Next slide, please. Bipartisanship, why it's important and what it looks like. The NDSC policy team is a nonpartisan organization. Our organization is nonpartisan, and we are bipartisan in our work. We believe that disability policy means policy for all. Disability policy is not a partisan issue. What I mean by that is it is not a Republican, Democrat, or independent issue. It is an issue for all of us, and we all need to work together to promote and pass policies that support all people with Down syndrome, regardless of political affiliation. Bipartisan bills also have a stronger chance of getting passed and enduring. We advocate for policies and not for people. We talk to and meet with both Republicans and Democrats. We have good staff relationships on both sides of the aisle. We are very, very careful about language and sign-on letters and endorsements. We also have our own bipartisan advisory council, which helps us to formulate our positions and review messaging tone. Jessie Smart, who you're going to hear from in just a minute, is one of the members of our NDSC Policy Council, which is that advisory council. Next slide, please. Go back one, please. There you go. If you can only do one thing, I would encourage you to sign up for NDSC action alerts. We do action alerts when there's a pressing issue that we need action on. You do not have to be an NDAC member to sign up for action alerts. Of course, I hope that you will sign up for NDAC, but NDSC action alerts are sent out, for example, when we need people to rally the troops to reach out to their legislators about the Department of Education. We write a draft about what's going on with a particular bill, what the issue is, and then all you do is put your name and address in, and it will generate a letter that we have put together and help you to send it to your elected representative or senators in your state, depending on the issue. You know, we all have a certain amount of capacity and time that we can dedicate to anything, and advocacy is no different. Some of us invest ourselves in lots of ways in advocacy. Others, the only thing we can really do is maybe send a letter to our elected official. And it's not only send, that's a really powerful thing for you to do. I jokingly tell people, but it's serious, I get notices of who responds to all of our action alerts. And I frequently get a number from 1 or 2 o'clock in the morning. And when I look at it, I think, you know what? There is some mom that worked all day, came home, got dinner for her children, washed the clothes, cleaned house. It's 1 o'clock in the morning, and she has 5 minutes, and she sent a letter to her elected representative. Well, you know what? That's okay, because we all have different capacity, and that's doing your part. At different times in our life, we have different capacity. I certainly hope many of you will think about and consider joining NDAC and reach out to me or others on this call about that. But if you can't, please sign up for action alerts. We definitely need more young families involved in policy advocacy. So I hope to see some applications come from many of you. Next slide, please. And I am going to turn it over to one of my favorite people, Jessie Smart. I do lots of presentations, and my daughter's my favorite person to do a presentation with, but Jessie is probably my second favorite person to do a presentation with. We say it's the Jawanda and Jessie show, don't we, Jessie?
Yes, we do.
So we're going to turn it over to you, Jessie.
Thank you. Hi, I am Jessie Smart. I am excited to share my advocacy experiences with you. People want to hear from self-advocates. It is important for self-advocates and really their parents and leaders to join the National Down Syndrome Advocacy Coalition, NDAC, so they can learn about policy and how to advocate and how to share your personal story. Every advocacy journey looks different, but all of our collective voices matter. Next slide, please. You can read my biography on this slide. I am from Olive Branch, Mississippi. I have 2 jobs, but I really enjoy my job with the ARC of Northwest Mississippi. I do a little bit of everything. I do data entry for social clubs. I do their filing, I do their shredding, I prepare fundraisers and events, and we also have staff meetings once a week. I have had many opportunities to advocate. I am enormously proud that the governor of Mississippi appointed me to the Mississippi Council on Developmental Disabilities last year. I am also proud to be on the NDSC Policy Council. The best thing anyone can do is to jump in and get involved. For me, as a self-advocate, serving on my local affiliate group board was to give place to really dive in. Next slide, please. Self-advocates are the most effective advocates. We have important things to say and want people to understand that we have the same hopes and dreams as others. We should be included at all levels of advocacy, from local to federal. Like all advocates, we need to have the necessary tools to advocate. Joining NDAC gives self-advocate tools and confidence to advocate for themselves in schools, jobs, and their communities. Really, NDAC and Advocacy Training Boot Camp is a benefit to anyone wanting to make a difference. Next slide, please. A few years ago, some moms in Mississippi launched the Mississippi Down Syndrome Advocacy Coalition. We are members of the National Down Syndrome Advocacy Coalition. They planned our first Down Syndrome Advocacy Day at the state capitol for March of 2024. They worked with the affiliates in the state to plan it. They invited me, and planning to invited Jawanda from the NDSC and me to lead the training. We were also shared about NDAC and learned what to do. Next slide, please. We had a press conference and invited families and elected officials to come. I was invited to give the welcome. It was one of my proudest moments to speak on behalf of all Mississippians with Down syndrome, their families, and others who love them. Other leaders with individuals with Down syndrome also have parts on the program. There is a link to a video of my welcome on the slide. Next slide, please. NDSC has many resources on their website to help anyone, whether they are on the NDAC member or not. NDAC members do receive extra resources through training webinars. Sometimes federal elected officials and committees reach out to NDSC for stakeholders' input on their issues. NDAC members then have the opportunity to impact policy by giving their input. There's a QR code and the website link to where you can find all the materials listed on the slide and more. There are templates that you can use in actual examples of one-pagers, written, oral, and voice testimony, video testimony. Next slide, please. Each year at the NDSC convention, the NDSC policy team hosts Advocacy Training Bootcamp. This will be the 9th Advocacy Training Bootcamp. It will be held on Friday morning, July 24th, 8 o'clock to 11:30 a.m. It is free. It is free with registration. Registration for bootcamp is encouraged but not required. It is admitted at beginners but good for even seasoned advocates. Anyone can attend. Of course, self-advocates should attend too. It takes 12 hours of training and condensing 3.5 hours to teach you how to advocate on any level. Parents, professionals, and elected officials, staff members, and self-advocates are all featured in a meaningful way. If you are coming to the NDSC convention, you should add it to your agenda. Next slide, please. All the resources and presentations shared at the Advocacy Training Bootcamp can be found on the NDSC website under Policy Area. Next slide, please. The NDSC Policy Advocacy Toolkit for Self-Advocates was developed by the NDSC Policy and Advocacy team with input from NDSC Self-Advocate Council. You can find it online using the QR code. You can get a copy in the back or find it on the NDSC website. While it was developed for self-advocates, it is a useful tool for anyone wanting to do advocacy. NDSC also has a state and local policy advocacy toolkit, like the Self-Advocate Toolkit. It contains helpful information, examples, and links for our advocacy journey. You can also find it with the QR code link on the slide or on the NDSC website under Advocacy Resources. When we advocate, we show that people with different abilities have good lives and make the world a better place. Remember, every person's advocacy will be different, but all of us can make a difference. Next slide, please. Now, I would like to introduce Magaly Diaz. She is the multi coordinator for NDSC and a Rocket Mom and NDAC member. Thank you.
Thank you, Jessie. Hi, Rockin' Moms. My name is Magaly, and in this photo, you can see my daughter, Audrey. She is 13, going on 23. And I was a part of the original Rockin' Moms group that formed in 2012, led by Jen Jacobs and Heather Bradley. So it has become very amazing to see everything that DSDN does now and how we all started on a little Facebook group, and now it's just this amazing organization and the apps. So for me, it is really important to let you, as young families, know that it is really essential that you guys start to learn about policy and advocating because it affects all people with Down syndrome, not just a few. And I've come across a couple of families that say, well, my kiddo doesn't receive Medicaid, my kiddo doesn't receive SSI. And so we feel like these are not issues that involve and affect us, but I promise you, eventually it is going to affect you. I wish I had learned more about policy and advocating when my daughter was younger and I was a stay-at-home mom, and all we did was receive therapies from early childhood intervention. I had a lot of time on my hands. Now it's a little bit more difficult. I did start becoming involved in 2020 when I joined Partners in Policy Making here in Texas. I live in Texas. So NDAC gives us information and tools that you need to be effective advocates. I finally joined NDAC in Orlando when I was not working with NDSC yet. I joined because I wanted to go to the NDAC town hall, so I became a member. So just be proactive and don't wait until something affects your family. So part of my job at NDSC as Multicultural Program Coordinator is mostly communication, social media, everything that we do on the English pages, we also put out on our Spanish pages, which I'll get to in a little bit. So social media, communications, newsletter, targeted emails, everything. We also have policy and advocacy resources that are in Spanish. We have 6 briefs in Spanish, education briefs in Spanish. We also have the toolkit that Jessie was mentioning on state and local advocacy. We have that in Spanish. So if you need any resources and you can't find them on the website and you're looking for the Spanish resources, connect with Jawanda or myself and we can get it out to you. I also host monthly free Spanish webinars open for everyone. I'm always looking at different topics, cover most of the age ranges. I also answer Spanish calls and Spanish emails to provide people with the resources that they are seeking. Most importantly, during convention registration, I help a lot of families do their registration just because things are a little bit tricky when you don't speak the language. So I get on one-on-one calls with them and walk them through registration. I also lead a circle for DSA staff that support Spanish speakers and basically collaborate with them and have them promote our webinars. At convention, we have a whole track that's presented in Spanish. Every cycle of convention has one spoken session in Spanish as well as one translated session that people can choose from. Of course, if you're bilingual, you can attend any session that you would like. This year in Orlando, we will have advocacy training boot camp in Spanish, or not in Spanish, but translated into Spanish. So make sure to register for that, and you will be able to get translation. We also have a sharing session that will be in Spanish, as well as a Hispanic and African American lunch. One is on Friday and one is on Saturday. These are also included and free with your registration for convention. And overall, really is to address diversity in all aspects of what NDSC does. I have a committee called the Diversity, Inclusion, and Representation Committee, and we just look at everything having to do with diversity. One example right here in this photograph is Ion was the award winner last year for the International Media Award, and they are a Costa Rican magazine. There are 6 self-advocates that are reporters. And the founder started this just because she wanted to have more visibility for people with Down syndrome in the media. So it is important to recognize all of the good work that is going on in Latin America. These are my contact. I have my email address on here as well as a direct WhatsApp number that I answer or text via that number. And then we also have an Instagram page at NDSEE. It's really confusing, but if you put this on Instagram, our page will pull up. And then on Facebook, we also have NDSC en Español. So make sure that you share these resources with any of your friends that are looking for information in Spanish. And next up, we have Chris Newlon.
Thank you, Magaly.
I am Chris Newlon, Resource Support Associate, and this is my daughter, Rebecca, who is counting the days to her 23rd birthday next month. When my daughter was younger, I didn't realize how much school supports like therapies are driven by federal and state policies. I just figured this was part of the whole system. Schools may provide them, but they are funded and protected by all of the policies, both state and federal. When budgets get tight, these supports can quickly become optional. I've been in school board meetings where the first suggestion was to cut services to special education and the therapies because they only serve a few students. And the only reason that this didn't happen was because the law required these services to be provided. That's why NDAC matters. It empowers families, especially those just starting out, with the tools, expertise, and confidence to advocate early. Because if those laws weaken, we know exactly what gets cut first. Next slide, please. Life before IDEA. IDEA is what helps to protect and provide for all of these services. I know this on a personal level because my younger brother acquired a disability when he was 9 after he had a brain tumor removed. He was developmentally and intellectually disabled after that. These quotes on the right are things that my parents actually heard when they were trying to get my brother back into the school system. Pre-IDEA, schools did not have to admit students with different needs at all. No therapies were ever offered in schools. Some large districts had a separate school that only admitted those with physical disabilities, and they would house all of those with intellectual disabilities, behavior issues, you name it, into large classrooms where they spent the day playing games, beating up on each other. I can't tell you how many times my brother came home bruised. There was no work that was modified. Accommodations did not happen. And very often transportation was often left up to the families. We need to protect IDEA. Next slide, please. Some of the resources that NDSC provides. We have webinars free. Recordings are also available online. We have presenters who are experts in their field, and topics include education, medical issues and therapies, aging, financial concerns, etc. In the past year, we started a 30-plus caregivers group, Gifts and Challenges. This is for caregivers of those who have a person in their family who's over the age of 30 and has Down syndrome. It is facilitated either by Dr. Dennis McGuire, but we've also had and will have other professionals like Ashley Barlow. We had a nutritionist recently. Those of you that don't know Dennis McGuire, he is a social worker who worked very closely for years with Dr. Brian Chicoine at the Adult Down Syndrome Clinic outside Chicago. He has co-written 2 books, Mental Wellness in Adults for Down Syndrome and The Guide for Good Health for Teens and Adults. Both of these books are just gold mines of information. The Mental Wellness in Adults for Down Syndrome can be found on the Adult Down Syndrome Clinic website. We can also send you a link. It can be downloaded for free. I know that some of you, like Magaly, were in the original group. I think I was in one of the original groups that allowed people with older children for Rockin' Moms. But these are issues that need to be read and learned about prior to them hitting you in the face. In the 30-plus caregivers group, all of the parents and siblings who are caregiving get to talk with each other, get to share ideas and solutions to problems. And I think the overwhelming comment that we've heard is, I thought I was the only one in this situation.
We also provide affiliate supports through DSAIA, and additional benefits are for DSAIA members and expanded learning. There's no reason to reinvent the wheel each time your group wants to do something. Personal responses. I'm very proud of this part. We provide personal responses to all emails and phone calls, usually within 24 hours. We at NDSC feel it's very important that if someone takes the time to send an email or send a phone call, that we need to answer it immediately, and we do. Next slide, please. This summer, we are having our annual convention in Orlando. It is at Hotel Signia, part of the whole Disney adventure. It is 4 days. We have activities for everybody in the family. We have childcare. We have siblings camp for siblings to go and learn about Down syndrome, learn about advocacy, and just share some of their feelings. We have a self-advocate youth and adult group for those who are age 15 on up, and all of their sessions are geared towards the self-advocate. We've been doing this convention for over 50 years. It's a wonderful place to not only hear from over 100 professionals, but to meet them up close and personal. I know that one of the very first conferences I attended, I was able to talk to a speech pathologist who was huge in the field. She has since retired, but for the next 4 conferences, I was able to have conversation with her and talk with her about my daughter's speech development. Registration for the convention did begin in March. So if you plan to attend, I would suggest registering now because many of the sessions are filling up, such as kids camp. It's not full yet, so you still have time. It's also just a lot of fun. Besides all the learning, we do have our dances, and there's the swimming pool and just the wonderful conversation and connection you can have with other families. Next slide, please. Here's more information about the convention. Scan the QR code to get many detail. If you have any questions, you can always contact me at my emails at the end. Next slide, please. Coming up September 29th and 30th in Washington, D.C. is the National Down Syndrome Congress Down Syndrome Policy Summit. This is a first for us, although everyone involved on our policy team is very experienced at advocating on the Hill. Registration will open May 14th. It is going to be held at the Omni Shoreham Hotel, which I hear is quite a la-ti-da place to stay. Next slide, please. Here's a schedule at a glance. Day 1 is about learning how to advocate most effectively, the do's and don'ts of discussing issues with our congressman. It's a wonderful day of learning. And then the next day we go to the Hill, meet with congressional representatives, elected officials, and then that's an all-day affair. But again, it opens up March 14th registration, and it is just an amazing learning experience. Next slide. Here's some questions. If you have any questions, go ahead and scan the QR code here. And then, of course, if you have more questions, we have our information at the end. So this is a quote from your very own DSDN Vice President, Rockin' Mom, NDAC member, Taryn. Why is prioritizing policy and advocacy work important? Taryn said, being involved in NDAC has helped me be informed on the many ways policy and programs affect my daughter. We often feel like our one voice isn't enough to make change, but you get to really see how our collective voices make all the difference. I feel so much more empowered as an advocate from everything I have learned from NDAC and look forward to raising a self-advocacy who can use her advocate who can use her voice as well. Please follow us on all of our social media. Those are our different names. Next slide. If you have any questions, please contact us at policy@ndsccenter.org or info@ndsccenter.org. I'm the one that answers all those info questions, so feel free to send me any question you may have.
Thank you for joining us today. We look forward to hearing from you. Bye-bye.